Okay, perfect. All right, welcome to Making KM Work, How to Reach Policymakers. This is one of our KM program showcases, just to show some examples of KM to policymakers and things that worked, some strategies to use, apply, or avoid based on our experiences reaching out to policymakers or being reached out to as a policymaker. We have 5 presenters, so we'll do a bit of a rotation to present, and we'll introduce ourselves as we present. My name is Stephanie Glegg, and I am one of the co-leads of the Knowledge Mobilization Program for Child Right. Please mute your mics if they're not already muted. Pop any questions into the chat. We welcome your questions. We'll have a time for Q&A at the end of the presentations. And if you need to leave early and have questions, you can still pop them in the chat and we can try to get them out to you. We do have an evaluation form at the end of the presentation. It helps us know what's working, what's not, and helps us plan for future sessions. So we appreciate you completing that. I want to start with a land acknowledgement. So I am joining from the traditional unceded homelands of the Coast Salish peoples, including the Musqueam, Squamish, and Tsleil-Waututh peoples, colonially known as Vancouver. Feel free to add your own land acknowledgement into the chat if you wish. I just wanted to acknowledge Indigenous peoples as stewards of the land since time immemorial. And the stewardship is a shared responsibility as we recognize the impact of colonialism on the land, on the waters, on the forests, in the air. So hoping that you'll all join me in that stewardship. Next slide is for our first presenter, which is Aryeh Gitterman, who will introduce himself and share about some ideas around beginning to influence policymakers.
Thanks, Stephanie. Aryeh Gitterman. I'm currently an adjunct professor at Toronto Metropolitan University. Prior to that, though, I spent quite a bit of my career in the Ontario government as one of the policymakers people talk about. I had responsibilities in children and youth services and education. So what I'll be talking about today is really influencing policy from the perspective of someone that people wanted to influence. So I'll talk about what I consider to be some of the important aspects of influencing people like me in my previous career from actual experience. And then I'll go through briefly some examples of different aspects of influencing that had an effect on me in a positive way. So this is not from a textbook. This isn't, a research discussion. It's an experience discussion. I think it's important because what you really want to understand is this is a beginning exercise. That is, you're not going to jump from doing research to influencing people in one jump. It's something that takes some time to develop. And as with anything difficult, it takes some practice over and over again, and it takes some relationship building. So here are the starting points. I say begin here because, as I mentioned, this is the beginning of an exercise if it's something you want to take part in. The first thing to keep in mind is that governments deal with problems. Their perspective is always, how do we fix something? What's the issue? What's the problem? So if you want to influence them, you have to have a good understanding of what the problems are that the government's dealing with. And I should say that I use the word government, but it also applies to any large institution. If you work in a hospital or a post-secondary institution, influencing the powers that be really takes the same form that I'm talking about. So first of all, what are they concerned with? You need that because you need to be able to make the connection between what they're worried about and what your work is. If there's no connection, you have a pretty small chance of influencing. Now, issue problem can take many forms. It doesn't mean it's stated clearly. It might be described in a document. Next thing is, what exactly do you mean by influence? Or what's the purpose of your interaction with the government or policymakers? Do you want to educate them? Do you want to mediate between different parties or options? Do you want to, and we use this language a fair amount in KM, do you want to translate your findings? But if translate is your goal, you're not going to actually accomplish any influence, because all you're doing is rewording what you've done. You're not making a connection to a problem or an issue. Influence, advocate, infiltrate. Infiltrate is not a word you find too often in these discussions, but I kind of like it. They're closer to what we're talking about today. And some of this has to do with your own belief system. Some researchers don't actually believe their job is to advocate, or to influence. That's fine. But if you're engaged in some social policy issue and you believe strongly in the value of your research, then you have to consider that you're moving into the influence arena. And if so, you then have to make some sort of connection to the problems that they're dealing with. Very importantly, next point is there an actual question or problem you can help with? And this, I put this down, it's similar to the first one, but I put it down because what I describe here are some of the ways to determine if you can help. One is, how timely is your research? Is it up to date and connected in a timely fashion to the issue of the day? Is it relevant to the issue, or is it anecdotal, on the side, not very directly relevant to the issue as they describe the issue? I have to put down credible because that's going to be a question asked of research. It's always asked. Can we trust these people? What's their background? How credible are they? Is it accessible? And by that I mean, can people understand what your research is about? And is it useful for solving the problem? Similar to relevant. If all those things line up, there's still another very important point, which is, are you interested in a short-term or long-term relationship? Short-term problems require input that's very different from long-term problems. Short-term problems government deal with are usually implementation issues, not big policy issues. The options have been determined already. Long-term problems, or difficult problems, give you a chance to interact around policy issues, not just implementation, because there are many options still on the table. Next slide. I think I ran out of time, but I'll go through a couple of these examples anyway. And these are examples from my experience. They go back, in some cases, several years. Some of you may be familiar with the Ontario Child Health Study, first round and the second round. The second time that was done, the researchers approached the government, I was in the position at the time, and asked for our input into what we were interested in finding out. That's very, very early involvement in research. And that created a relationship that lasted for quite some time, because we had input into what the research was. If you want to influence people, letting them into your research is one way to get them to trust you. I'm going to move down to the FASD one just in terms of time. That entire relationship that I had on FASD was very much at the beginning of the government trying to figure out what to do. And it was almost entirely related to education. What we did is invited people to talk to us. We just wanted to learn. We didn't want to hear any propositions about what to do. We wanted to learn what they knew, and we would decide what was relevant for us. Low risk, we had very positive turnout, and we learned a lot. Goes back to trust and relationship. Education is very different from influence, and that's fine. A lot of people in policy making don't know enough about the topic, even though they have the job to do something about it. Education is a really good starting point. And that means neutral in terms of advocacy. You're not talking about what you want them to do. You're talking about what is known about that problem. Turnaround schools. This is an education example, but it's one of my favorites. Turnaround schools was an exercise we undertook to improve the EQAO scores, that is the standardized testing scores in low-performing schools. We took what we believed at the time, and I still think is a very innovative approach. We had an expert, widely recognized in early reading, go into schools with low performance and do sort of assessment, a report on how the teaching was being done in that school. Neutral, not positive or negative, descriptive. And then we hired a principal and a teacher to take that information and work directly with the teachers and the principals. So we formed multiple relationships between research and practitioners in the same program. That's difficult to manage. It worked really, really well. And it turns out, little anecdote, it's not that hard to improve reading performance in schools that have low performance, if you put the right pieces in place and it's not threatening. I use this example because it shows that you start with information, not with, this is what you must do. And the last I'll use ASD, autism. Very briefly, some problems never go away. Some policy issues never disappear. The government of Ontario didn't even get involved in autism until 1999. It's still determining policy and program. If you're in one of those problem areas, look forward to a long relationship over many years if you want to have any influence. It's not going to be effective if it's a one-time thing. I have the answer of what you have to do now. Good luck with that. Long-term, or don't bother. I'm done. Thank you so much.
Thank you, Ari. I'm going to share an example of a short project summary that I developed for government. And it's not in the field that ChildBright operates in. It's in adult substance use. I did this during my postdoc, but it's an example of a way to put together information in a way that is visually engaging and provides the information quickly that, in this case, policymakers wanted to know. So next slide. It was basically a 2-page, so front and back. This is all one page. I just had to cut it so that you could see some of the information. And so branding at the top. So where is it coming from and what were we doing? We were doing a national environmental scan of the emergence of safer supply during the pandemic. And so just like an article, provided a bit of background about what we were doing and why, and then very briefly methods. And then I use color and boxes to kind of make key information pop out of the page. So why is this important? And then rather than lots of text, putting a map to show where things were before in the white circles and then where they were during the pandemic with the red numbers to show the rapid emergence of new programs. And then a little bit about the types of clients that were there. On the right-hand side, you'll see pre-post pandemic and the number of the sites that were providing different substances. So the new ones are in red, matching the map. You can pop to the next page. So this is the back where people were interested in what kind of service delivery models were available, where are these things happening, how did they dispense things, what else was available, who was funding them. So I used icons and white space to make it more visually appealing with headings so they could quickly find the information they needed, consistent color scheme, and then at the bottom of the page were facilitators and enablers of implementation. So they could learn from our interviews about what made it easier or more challenging for clinicians to adopt this approach. And so we put this on the website, we emailed it to folks, we also presented to them, but this was a take home that they could have, and then shared it on social media. So we were also able to share it with the clinicians so they could learn about what happened in the study if they took part, or others who were interested in learning more about the state of affairs and how it might influence their practice. I'm going to pass the torch to, I think, Catherine.
Yeah.
Yeah, Catherine and Jillian.
Yeah. So next slide. My name is Catherine. I'm currently an assistant professor at the University of Quebec in Trois-Rivières, previously a postdoc in the Child Bride Network, and still a member of the Child Bride SCAM program. So now, I don't know, Jillian, if you want to introduce yourself now.
Yeah, I'm Jillian. I'm part of the CAM committee as well as the National Youth Advocacy Council for a little bit. And yeah, I'm here to talk with Catherine about our AI generated summaries.
Jillian. Yeah, so I'll maybe start by explaining why and how we can use AI for this purpose, and then Jillian will walk you through an example from one of our projects. So why use AI to generate plain language summaries? So as many of you know, research findings can be complex and hard to understand for people who aren't specialists in the field. So if we want those who could benefit from this research, such as policymakers who are not researchers, to actually access, use, and benefit from it, we need to present it in a way that's easy to digest for them. And knowledge mobilization experts have been doing this kind of work for a while. But now with AI, it's much faster and easier to create plain language summaries and also adapt them. So basically, the main reason to use AI here is to reduce the workload for research teams, allowing us to be more efficient. So how do we do it? Well, first, it's very important to be intentional and cautious in how we use AI. So we think that we should use it as a tool to support our work and not to replace us. That means using our judgment and our critical thinking to ensure that the output is accurate and relevant. So the first step here would be to choose the right tool. And this field is evolving very quickly, so it's worth exploring all the available options and selecting the one that best meets your needs. So I've listed here some tools that are specifically useful for generating plain language summaries of research papers or other documents. So next, we need to be very clear about what we want AI to do. So we need to be able to give it very specific and detailed instructions. So for example, instead of just simply asking for a summary, we should specify the desired reading level. So for example, if it's for families, it could, or youth, it could be something like grade 6 or grade 8, or if it's for policymakers, it could just be to avoid using research jargon. And very importantly, we have to specify the intended audience, because as you can imagine, a summary for example, youth for disabilities or healthcare professionals will look very different from one that is meant for policymakers. And yeah, going back to what REA presented earlier, we can also include here in the instructions what the purpose is. So for example, is it to educate, to advocate, to influence, and then the message will be tailored accordingly. And it also helps to provide a template or at least indicate the format. So are we looking for a 200-word text summary, or is it meant for an infographic or a slide presentation? So really the key here is trying to be as specific as possible. And then just the next step will be to review and revise the output. So we don't use it as it is. What I usually do is generate a first draft with AI, and then if major changes are needed, I might go back and refine my prompts or instructions. If the changes are minor, I'll just edit the draft myself. And ideally, we always collaborate with team members and people from the target audience to just gather feedback and make sure that the final version is accurate and appropriate. So now I'll hand it over to Jillian, who will present a project we've been working on.
Great. So, our goal was to create accessible, evidence-informed resources for youth and clinicians navigating the transition to adult healthcare. Many youth with special healthcare needs don't really have support in that gap to go from pediatric to adult healthcare. So we're trying to find articles that bridge that gap or resources. So our resource specifically is for youth with brain-based disabilities, their families or caregivers, and then clinicians or health system leaders. What's instead our resources is guidelines, programs, and tools, and peer-reviewed articles, a few with lay summaries. Next slide. Okay, so as Catherine said, we used AI to create these summaries, and we also used the collaborative approach when editing, especially when it came to the summaries, because we had to get approval from authors, and that's still in the works as far as I know for some of them. This was co-designed with lived experience partners and clinicians. We tried to integrate as many perspectives as we could while making it as accessible as possible for each audience. So we used icons, headings, that kind of thing. We really wanted to value accessibility and also make it a useful resource. So we wanted to really address the problem while elevating youth and family voices. Next slide. So this is just a screenshot of an example. It doesn't show all of it here, but we tried to create something that was easy to read and also skim. So if you're looking for a specific resource, it's easy to find. So as you can see, we use headings and also icons to help guide you. And then we tried to separate each section so that it makes sense and it's consistent throughout. We provided clickable links, and this is kind of the same format throughout, as well as our references. we adapted the citation style a little bit to make it as accessible as possible for screen readers and things like that. So yeah, that's all I have on this. Thank you.
So I think I'm the next one.
Go ahead, Roberta.
So yeah, so I'm the next one. So I'm Roberta, and I'm a research associate at the Child Right Knowledge Mobilization Program, and I'm gonna talk a little bit about how the KM program is going about writing policy briefs to reach policymakers. Next slide, please. Thank you. So there are a few things that I want to just point out to you that we always take in account when writing the briefs. I explained very well during his presentation about how to begin in terms of considering when we are interacting with policymakers, in educating them or changing behavior, etc. So I'm not going into the details, but I thought that was important to add here as a reminder. So what to know about policymakers, what they like to see in the policy briefs, for example, they prefer it short, to the point, clear, that has information that is relevant to current policy debates, for example. And I add here some characteristics that we always thinking about when writing policy briefs. So in terms of focus, scope, accessibility, and etc. So in terms of what's a policy brief, so imagine that you are elected official serving a community dealing with a complex issue, for example, and the economic consequences of diverse possibilities, possible approaches. So you want to, and more importantly, you want to make an informed decision. So but we don't have the time to research of these issues, so we need a policy brief. So policy brief is meant to present a concise summary of information that can help readers understand and likely make decisions about government policy, funding policy. So um, Ari talk about when you talk about policymakers to open your minds to not thinking only about lawmakers, right? But politicians, but hospitals, CIHR funding policies, for example. Slide 2, please. So another important to consider is dissemination, right? So to increase the potential influence of a policy brief is important to consider a broader dissemination process using a variety of medium forms. So this means going beyond standard publications, for example, presentations. So at a knowledge mobilization program, we try to, when disseminating policy briefs, we go to social media, we email key policymakers, we hand them out in in-person networking. You may see myself or, for example, Keiko. We print the policy briefs, and when we go to meetings, we have them with us. So we just kind of hand to keep people for them to look into it, and it may end up teaching them something. Another thing that we used before was we usually use its website. So we send our briefs or policy briefs to websites
One that we commonly use, it's the House of Commons Committee's website when we have our policy briefs there, intending for example, the senators to read them and consider, in our case, issues related to youth with disabilities, and so oral presentations as well. So you can do YouTube, and then I don't know if you guys know about slide shared platform. So, but there is a location where you can do your oral presentation, have some slides about your policy brief as well. Next slides, please. So here I have some examples of policy briefs that we did. The first one was a collaboration with the Down Canada and the Department of Equity, Ethics and Policy at McGill, with an internship that, so we had students work with us, and we look into the intersectionality in the disability policies, and we have a brief. We wrote a policy brief, and that is available in the Down website and Mac websites. And then the second one was a policy brief that we did looking into the Canada Early Learning and Childcare Act. So the Bill C-35 was passing the House of Commons, so, and we want to influence the decisions, so we wrote policy brief after a wrapped policy review that we did, and we send emails to the members of the committee responsible for the bill. And another example was a policy brief that we did for CIHR. So there is a project about developing the Canada health indicators for children with disabilities that we got a grant from CIHR, and at the end of the project we wrote a policy brief, and the policy brief is available in the CIHR website. So Alex, go ahead for your presentation. Thank you.
Thank you, Roberta. And I'm Alix, the coordinator for the Child Right KM program, and also information officer. So I'm going to talk briefly about an example of a KM activity that we did at the international level. So we participated in a recent CRPD committee. The CRPD, or also called the Convention on the Rights of Persons with Disability, is an international human rights treaty, and Canada ratified the CRPD in 2010. The main goal of the CRPD is to protect the rights of persons with disability. And the Article 7 of the CRPD focuses on children with disabilities. It states, for example, that states parties shall take all the necessary measures to ensure that full enjoyment by children with disabilities of all human rights and fundamental freedoms on an equal basis with other children. So you can go to the CRPD website and obtain more information about all the different articles that it covers. So in March 2025, Keiko Shikako, who's the co-lead of the KM program at Child Right, and Brenda Lenehan, who's also a parent partner, photographed here on the slide, went to Geneva with the Canadian Civil Society Coalition to ensure that children with disabilities were represented in the process of the CRPD. So Keiko and Brenda did share key challenges faced by children with disabilities and their families in Canada. They shared that information with the UN CRPD committee and spoke to Government of Canada officials about improving support and ensuring that children's rights are reflected in our policies. So their inputs helped shape the UN concluding observations, which are now available online. And those concluding observations will help guide future policy, research, and advocacy efforts. So what did we learn during that process? We learned that it's crucial to start early in the process, and that meaningful contributions begin with early and inclusive engagement. In our case, for example, we did collect data and insights from a variety of sources, especially families in our network and researchers. So specifically families with lived or living experiences and researchers that specialize in childhood disabilities. So members from our network provided meaningful impacts during that process. So we also learned that it's equally important that we share the knowledge back with our broader community. So when Brenda and Keiko came back, we did a LinkedIn post around the process and what they had done. And we are also using accessible formats like lay summaries and infographic, which we are creating right now, to help ensure that the information is easy to understand and is widely distributed. So in conclusion, it's important to ensure that there's a two-way exchange, not only to build awareness about the topics we care about, but also to strengthen the quality and impact of our recommendation and also foster collaborations. Thank you.